our panel discussion of the Cape Fear Valley Psychiatry Residency Program and share with you all a little bit about what's going on with that residency program, as well as our behavioral health service line in its entirety. First of all, I want to thank you all for taking some time to join us this afternoon, to take your lunch hour to be with us. I am Sabrina Brooks with the Foundation, and it's my honor to be with you all and to facilitate this discussion today. I'm going to go ahead and kick it off by welcoming Mr. Michael Nagowski to the panel. He, as you all know, he is the Chief Executive Officer of Cape Fear Valley Health, and we are very honored to have him take a little bit of time to share with you all some of what's going on at Cape Fear Valley Health from a top-down perspective, if you will, before we delve into a little more details about the psychiatry and behavioral health areas. So, Mr. Nagowski, welcome.
Sabrina, thank you, and thank you for giving me an opportunity to tell you about some of the things that are going on at the health system. I'm really looking forward to hearing more about the behavioral health services, but I wanted to take a few moments here and just give you a sense of some of the other things that are going on in the health system before we turn it over to the behavioral health team. So could I ask someone to move the slide up? As you know, at Cape Fear Valley Health, one of the things we do really well is continue to grow to meet the needs of our community. Growth for us means not just more visit volume, but it means growing the set of services and the facilities that we have to support the community's needs. And the next slide is a great example of that. Cape Fear Valley in the last couple of months has welcomed the Harnett Health System into the family. Most people know that the Cape Fear Valley Health System is comprised of the medical center, the behavioral health hospitals, the rehab hospital, and Highsmith Rainey here in Cumberland County. In Hoke, we have the state's newest hospital, and in Bladen, we have a critical access hospital that's been part of Cape Fear Valley since 2010. Well, this year, Cape Fear Valley welcomed the entire Harnett Health System into the family. Harnett Health, for those of you who don't know, is comprised of two hospitals. Betsy Johnson, which has been around since the 50s, is located in the city of Dunn. It's right off of 95. And one of the newer hospitals in the state of North Carolina is in Lillington, and it is creatively called Central Harnett. In addition to providing medical and ICU beds, we also will begin performing surgery, and we've been doing cardiac catheterizations there now for more than a year. In addition to the hospitals, we have a plethora of physician offices, both primary care and specialty care. Our newest physician office we opened earlier in the year in Buffalo Lake. So we're so excited that that community, that board, that medical staff, and that employee workforce wanted to become part of Cape Fear Valley Health and no longer just managed. So exciting for that growth opportunity. Next slide, please. Here at the health system, we continue to grow to meet the needs of the community. One of the ways that we've been growing is to simply add additional floors, additional beds to the medical center. 4 North, which has been for the last 20 years an administrative space, has been reclaimed. We tore the entire unit down to the studs and rebuilt it. And here in the coming months, we will add that to the bed portfolio. So 20 more beds being added here to the medical center, and that'll be on 4 North. And then the next slide, you know, people ask me all the time about the construction projects we have going on here at the health system. And it's so obvious from Owen Drive. Everyone sees the Center for Medical Education, where that new 120,000 square foot facility is going to be opening next summer. But I routinely tell people that perhaps the most important construction project we have going on here at the health system is our new adolescent unit. And you can't see it from Owen Drive, but if you were to drive through the campus and to look where the adult behavioral health hospital is, you would see right across the street from that behavioral health hospital is a brand new facility. And we're really excited about it because it's such a necessary service. In today's world, if you had a teenager, an adolescent who had psychiatric needs that required an overnight stay, it's really a problem in North Carolina. Routinely, we hold adolescents in our pediatric emergency department because it's the only place. We routinely have patients there waiting often weeks to find placement somewhere in North Carolina. Well, soon all of that ends. Our adolescent unit, and we're so proud that the state, through the Dorothea Dix Foundation, was able to provide the funding for this, but we will open that unit. And ultimately, it will end up as a 16-bed adolescent unit. But here in the next month or two, that unit will open. And I'm not going to steal any of the thunder that the doctors are going to talk about, but it will support our growing residency program and ultimately our fellowship in pediatric psychiatry. So we're excited about that construction project. And then the next slide, it's hard to talk about growth here at the health system, not mention the big dig that's going on outside the campus. This is a 120,000 square foot, 5-story facility. Its primary purpose is to provide space for our growing residency programs. And I know Dr. Maharty is going to talk more about that, so I'll not steal any of his thunder. But we're real excited about this. The construction is going extraordinarily well. This building will come online in the summer of 2022. In addition to the residency space and the simulation labs for the residents, they will also have personal space inside of this facility, state-of-the-art classrooms, state-of-the-art conference areas. We'll have food options. We expect both Chick-fil-A and Panera Bread to be offering retail services in that facility when it opens. And then the top floor of the facility is where the Neuroscience Institute will be relocated to. So finally, our neurosurgeons and neurologists will have a facility that matches their skill set. We're real excited about this. It will transform the campus and it'll bring a whole new level of service for the organization. And then my last slide, as our academic mission continues to gather steam, one of the byproducts of that is our clinical research. Dr. Sam Fleishman and I started researching how do we get clinical trials more accelerated here. And in 2018, we started the Carolina Institute for Clinical Research, and we did our very first clinical trial through that organization in 2018. And you can see the slide deck. Every year we've done more clinical trials, and this year, by the end of the calendar year, we'll have performed almost 40 clinical trials through CICR. Real excited about the momentum there. Our expertise, our focus has been COVID vaccines. As you know, we are a significant clinical trial site for the Moderna vaccine, but we also spend a lot of time and energy in the women's health, oncology, and diabetes and nutrition space. So, we're starting to really see the halo effect that the academic programs are bringing here to Cape Fear Valley. So thank you for giving me an opportunity to talk a little bit about some of the growth initiatives. One of the biggest growth initiatives, I think Dr. Maharty is going to talk about next. But Sabrina, if people have any questions about either what I've talked about or anything about Cape Fear Valley in general, I'm happy to answer those questions.
I apologize. Thank you, Mr. Nagowski. And as a reminder to our participants, if you do have questions, we encourage you to drop those in the chat and we'll make sure that we have those addressed. As Mr. Nagowski referenced, we do have a really big program that we have been growing over the past several years with our residencies and the expansion of those programs. So I'm going to now turn it over to Dr. Don Maharty. He is our Vice President for Medical Education, to share with you where we've been with this residency program, where we're going, and the exciting things that are ahead. So Dr. Maharty?
Yes, thank you. Thank you for having me join you today. We're honored. I just wanted to say first, thanks to everyone. This has been a community project, and from the vision from our CEO and our board of trustees, to the community support that's been behind it, to all of the program directors and faculty who really gave an effort to start this from the ground up back in 2017 is when we started our residencies. to the residents who have performed extraordinarily well. So proud of Dr. Klenzak and the psychiatry staff and all the faculty and the residents. They've really represented Cape Fear Valley well, expanding their program. And I'm going to let him talk about more of that, but we're just so honored to be part of this and such a need for the community right now. So saying that, where are we at? If we can go to the next slide. Where are we at? What's happened since sort of a dream in 2010? And I came on in 2015 to help this program along and work with such wonderful people here in the community and at Cape Fear Valley. They've been so supportive and really gone to the nth degree to make sure that we have outstanding programs and are supplied with everything that would compete on a national level. And I think you'll see that here. But what we've started with is 5 programs, but where we're at now is we have approximately 198. Actually, it's 214 residents approved in the healthcare system right now. But cardiology fellowship was one of our latest ones to come on. We have 6 residents now approved for 9. Internal medicine, 60 residents. We have about 51 in the programs now. Emergency medicine is approved up to 44. It is the second largest program in the state. The largest one is 45 at Wake Forest. And then transitional year is approved for 20. General surgery is 15 residents. We'll be going to 20. We hope. We have a request in for expansion. And then OBGYN is 16 residents. Psychiatry is currently at 16 residents, but it will be moving to 32 over the next few years as we progress here over the next few years. And then we have a pharmacy residency with 9 residents, and then podiatry is our very latest that we brought on this past June. So the total number of learners in the system, when you include about 120 medical students, is 318. 318. You can go to the next slide. What is in the hopper now? It takes a couple of years to really get a program started. So we've been working on a child and adolescent psychiatry residency with their program director, Dr. Sree, Jadapalle, who's done a great job of writing the application. And we'll know in what is a January, February timeframe that program will be approved for about 6 residents. Actually, it says 4 on there. And then orthopedics will also hopefully be approved in January, February by the ACGME for 20 residents. We expanded that from 10 to 20. So they'll all be our future programs. All told, these are the programs that we've been actively working on, interviewing program directors, looking for the right fit, and starting with great momentum. So more on that. Next slide. If you look at what is the future over the next 10 years or so, it's a little bit overwhelming, but where we're going to be at, we think quite shortly is next slide, is that we'll have around 302 residents in our programs by 2028. We're actually ahead of schedule on this. Currently, if orthopedics and child adolescent psychiatry comes onto the picture, and we just are now united in one health system with Harnett, we're at 297 residents, totally approved slots for the healthcare system. So we're pretty close here, but as we expand more, you'll see we're actively looking at some of the shortages that are going on here, like dermatology, pulmonary critical care, and all the others that you see on there. So that's the vision for GME and the expansion, hence why we need the building that we'll show you here in a second. Go ahead to the next slide. What is this building going to hold? Well, as Mr. Nagowski said, 120,000 square feet. And I'm just going to give you a quick, brief overview of the educational facilities. First off, we're going to have a state-of-the-art holding at least 500 with desks seated in a learning situation with a computer desk. We have 500 auditorium. It holds 500 people. So we can have massive gatherings and bring in some of the best lecturers from our own healthcare system or across the country to speak to all of our residents and medical students at one time, creating a lot of synergy and unity around topics and hopefully energy and interaction. The room breaks down into 3 separate rooms, and that can all function independently or one large room. So it's quite a state-of-the-art facility with gathering rooms outside in the auditorium where we can have we can mingle and continue on with scientific progression and developing relationship and family. It's kind of what we are in GME. We're trying to develop a family. The other thing that I'd like to chat about is on the third floor, we have a resident lounge, which is state-of-the-art computers and areas where they can rest and relax. We also have a sim lab that is state-of-the-art, and it's about 3,000 square feet. It has a full OR, a full OBGYN delivery room, ER beds, and an ICU, and then training areas where you can show videos and debrief from the simulation. We'll be using those elements. We use them already in one small room. We're very excited to expand and use this throughout the healthcare system. Okay, next slide. So, where are we at right now? We're only basically, we're finishing up our 5th year in residency. And so we're finally having some graduates. We've had over 70 graduates when you include the transitional year, but when you include those who are in our residencies, we've had about 30 graduates come out of our residency programs, and they had the option to come back to Cape Fear Valley and help us or move on to other healthcare systems. And what we've had, we're proud to say our retention has been over 50%. 15 of the 30 residents that have graduated, 2 out of 3 OBGYNs have stayed at Cape Fear Valley, chosen to work here. 5 out of 7, the emergency medicine residents, 8 out of 21 internal medicine residents. And right now, I mean, we don't have the final numbers yet, but I know we have some other residents coming back, one from psychiatry of the 3 that are graduating, and others that will be added to this. And these numbers are a little bit deceiving because 6 of those 30 actually went on to do fellowships in nephrology, 3 in nephrology, cardiology, palliative care, critical care, and we have more of those moving on. So it's about a 70% retention rate for those eligible. They chose Cape Fear Valley to come back to our needed areas, and some of them are going to be going out into other areas across the community that are rural, underserved, like Hoke and Bladen, and I'll show you those numbers in a moment. This is good. This is above the national statistic, which says about 50% will stay back in your healthcare system. So next slide, please. And so this is a Merritt Hawkins study that says, yeah, about, within 50 miles, we have residents, about 50% will stay back. And that was the goal, to help with the healthcare shortage of professionals and delivering ultimate outcomes, outcome delivery, where we have healthier patients because they have well-trained physicians to take care of them. Next slide. So in summary, what's gone on here since 2017 is that we have 9 programs in our healthcare system here just at Cape Fear Valley. We're awaiting an orthopedics and child adolescent psychiatry residency or fellowship that will start here in hopefully 2022. And we're expanding our psychiatry residency from 16 to 32 and our general surgery residency from 15 to 20. We've had a growth in residents. Right now we have about 171 in the system active, but we have about 214 positions. When you add in Harnett and orthopedics and child adolescent, we're almost at 300. We've had a high retention rate, 50%, excluding those who went on to fellowship, so it's even higher than that. And then lastly, we're trying to address the physician shortage in the rural areas. Of the 15 residents, at least 6 to 8 will be working at Hoke, rotating in and out of those emergency rooms or internal medicine areas at Hoke and Bladen. And we're excited about psychiatry, so I think they're going to be doing great things here as we graduate our first residents this year. And I'll let Dr. Klenzak go ahead and fill that area. And so that's it. It's been great chatting with you today. And any questions, please go ahead and you can put them in the chat box.
That's great. Thank you, Dr. Maharty, for that background. It's exciting to see the growth of the program. And we're excited to really focus on the psychiatry residency now. I'm going to take a few minutes to first introduce our panelists. We've got a great group of folks here representing the Psychiatry Residency Program as well as our behavioral health services. So I'm going to start off, and if y'all just want to wave so everybody knows who's who, that'll be great. Dr. Scott Klenzak is the program director of the Psychiatry Residency Program. We are happy for your leadership. He's been a part of this program for many, many years. Dr. Ken Fleishman is the department chair and a core faculty member of the Psychiatry Residency Program. Dr. Sree Jadapalle is the program director for the Child and Adolescent Psychiatry Fellowship. So that is very exciting now that we're able to add that to our collection of programs. And Mr. John Bigger is the corporate director of Behavioral Health Services for Cape Fear Valley Health. So thank you to you all for joining us. We also are excited to have two of our residents from the psychiatry program. Dr. Victoria Teague is a psychiatry resident in the class of 2022. She attended medical school at Campbell University, so we are glad that she stayed in the area and joined this residency program. Dr. Malcolm Vaught is a psychiatry resident in the class of 2024, and he attended medical school at the Virginia Commonwealth University School of Medicine. So thank you all again for joining us. I want to get started by asking Dr. Klenzak and Dr. Fleishman to give us a little bit of an overview of the psychiatry residency program. What does that mean? What do these young doctors do when they join our residency program? Just a little bit of background for our listeners.
Yeah, thank you so much. And I appreciate everyone taking the time to be here, and certainly appreciate all the support I've had over the years in this program. It's definitely a team effort. We have a great team here that you see. Starting this, 5-6 years ago in the planning and development phase, it's been really, it's been challenging, but it's been exciting, and we've come so far so quickly, as Don mentioned. We're bringing in great young doctors and training them to be psychiatrists, and we've expanded our program from 16 to 32. We're going to have 30. We're going to be graduating 7-8 psychiatrists every year. We're going to be filling this child psychiatry fellowship up with fellows. The energy and the expertise that we have, that we're attracting from all over the country, is amazing. And so the residents come from all over. We have some from North Carolina, some from South Carolina, some from Virginia, some from Maine, Massachusetts, California. They come here to Fayetteville, and day one, we orient them, and they start seeing patients. They start seeing people in the community. They work very hard all 4 years in the program. Faculty work directly with them. We got some of our faculty here. Some of our Dr. Jadapalle and Dr. Fleishman are both child psychiatrists. I'm a child psychiatrist. They rotate through all of our different service lines. We have an inpatient unit, an outpatient unit, a psychiatry crisis unit. They see pediatric patients, so they work very hard. I do have to brag a little bit about the two residents we have here today. Dr. Teague was our first resident who started the program, along with some other colleagues, some other residents. She's our chief resident this year, which is a big deal and a big responsibility. She is going to graduate next summer, and she's signed a contract and staying on as faculty. And I've got big plans for her over the next few years. She's going to be a big part of our program. She's going to be a leader with the residents. Having young faculty who graduate from the program is a strength. It doesn't happen automatically, and so we're thrilled that she's staying on. She just won a national award from the Austin Riggs Center in Excellence in Psychotherapy. It's a national competitive award. Only 10 residents in the whole country got that award, so she's one of them. I do have to brag on Dr. Vaught as well. He just won a national competitive fellowship. Only 2 in the country get this, and past winners have been from like Harvard and Duke and Stanford, MUSC, very top tier programs. And he just won that fellowship, and it's a 2-year appointment where he's going to be representing not just our psychiatry department and program, but Cape Fear and Fayetteville and really North Carolina. So it's exciting to have these smart, engaged young doctors and be part of our mission at Cape Fear. So I'll turn it over to Ken. He works day in and day out. We work with residents every day, and so I'll let Ken talk more about that day-to-day work too.
Thanks, Dr. Klenzak. It's exciting to be here, and I appreciate everybody listening to what we have to say, because it's important that we're able to serve this population. I moved back here about 7.5 years ago. I grew up here. My younger brother is the chief medical officer, and he kept trying to get me to come back. He's also a psychiatrist. And finally, I listened to what he said, and glad I did. I'm a much better psychiatrist from having come back and working in this population and working with the other faculty and residents that we have. I always tell the residents that they make us better doctors, because they don't let us just sit back and rely on old ideas. They're always asking us about the newest techniques, or isn't there a better way to treat this? And they want the best for the patients, as we do as well. So we've all been very excited that Dr. Klenzak took the lead on getting us this residency. Most of us came here to be community psychiatrists, but when the option came up to have a residency, we all were very much in favor of doing it, and so pleased that he took this on, because he's been a great leader and spokesperson for the department. As he said, we work with our residents every day, and they're always very impressed by the patients that we have and the kind of energy that they bring, and the desire for treatment and care that they and their families have. And I feel very fortunate to provide that for them in this area. A couple of years ago, we did a needs study, and we already found that we need 15 to 17 more providers just in psychiatry alone. And that doesn't also count child psychiatry, which you'll hear more about in a few minutes. After I came back here and began working with Mr. Bigger and Mr. Nagowski, we made it a priority to try to get an adolescent or child unit here. It was a real area of need when we had 10 children in the emergency department, and half of those could be waiting to go for another inpatient hospitalization somewhere else, and they would have to leave their community and their families. So we're so excited that now they don't have to drive anywhere from an hour to 3 hours just to have family sessions. So we couldn't be more pleased that we've got the Dorothea Dix Adolescent Unit opening up soon. It's going to allow us to train child and adolescent residents, and that's so important because, as you can tell, a lot of us end up moving into leadership positions. I'm not sure what that says about child and adolescent psychiatry, but we always need to have more just to treat the patients, because working with children takes longer. It takes longer to work with the children. It takes longer to work with their families. And people who do it tend to have a lot of energy, but we need more. And so we look forward to being able to provide that for the people in this community as well.
Very good. Thank you, Dr. Fleishman and Dr. Klenzak, for that background. And congratulations to our 2 residents for your awards. That is fabulous, and we are very proud of you and happy to have you representing Cape Fear Valley Health. At this point, I want to pull in Dr. Jadapalle to tell us a little bit about the Child and Adolescent Fellowship in particular as we begin that program next year. Dr. Jadapalle?
Thank you, and thank you all for giving me this opportunity. So I've been working with Cape Fear for the last 5 years, and as Dr. Klenzak and Dr. Fleishman mentioned, the leadership already planned out to have this fellowship given the needs of the community. And I'm glad that we were able to execute the plan and that we achieved all the milestones on time. So the application is in for the Child and Adolescent Fellowship, and we will be aware of the results like in January or February. And it looks very positive because we have all the faculty we need, we have all the resources we need, and we already have our residents prepared to join the fellowship. So that's the most important thing. We'll be recruiting 2 to 3 fellows each year, and July of next 2022 is the highest possibility to get our first class of fellows to do this fellowship. Dorothea Dix Unit will be the main location to train our residents and child and adolescent fellows. That's the place where they will learn to work with children and families, do their teamwork, work with the community, DSS, all other local resources, and local psychiatrists. So this is a very exciting time. And as Dr. Fleishman mentioned, we need so many child psychiatrists in the community. Just in these 5 years, looking back, the last 2-3 years, the census of the children we are seeing in our emergency rooms have actually doubled and tripled. You know, we have 8 to 10 kids waiting in the emergency room every day to be sent out to outside hospitals. So the Dorothea Dix unit is going to accomplish that role, and also our fellowship will be producing more doctors to serve the community.
Very good.
I do have to brag about Dr. Jadapalle. So she's one of our star faculty. She's won several awards. She's presented at national meetings, several research projects, case reports, and also she's recently named one of the physicians of the quarter recently. So she's been a tremendous help with the general residency program, and now stepping into this leadership role, both on the inpatient unit as well as the fellowship. And you know, she was down there with Dr. Bob this morning in the ER seeing half a dozen pediatric patients, and we don't have any place to send them. And so it's really a crisis. It's a crisis in mental health, and having this expertise here in Fayetteville and having this unit is beyond amazing. And so I'm so proud to be part of this team.
That's great. Thank you. We are very fortunate to have the physician leaders in this program that we have. I'm going to now turn our direction to Mr. John Bigger. John, can you give us some background on how we were fortunate enough as a community to be able to have this Dix unit that will be opening up very soon? Can you give us some background on that and what that project means to our overall behavioral health services?
Okay, sure thing. Thanks for having me on this today. My job is easy. I get to work with everybody you see here on the screen. The expertise, the award-winning psychiatrists that we have all make it where I just value coming to work every day. The Dorothea Dix Care Unit was first conceived by Dr. Ken Fleishman and Mr. Nagowski and myself. I've been here about 6 years, and it was already an idea that long ago when I first came on board. And it was based on the fact that we have so many children in crisis that are presenting to our pediatric emergency room. Not only that, they were in the schools presenting to the school counselors. We would get phone calls from community members saying, what can I do with my child? So while we recognized it as clinical professionals, the community also recognized the need. And this community supports this program like you wouldn't believe, and we're real proud of that. The way that it came about, not everybody has a pile of money laying around to be able to build one of these buildings. So we worked through a variety of grant providers, foundations, funding sources, and then a few years ago, the Dorothy Dix property in Raleigh was sold. It was around a $45 million, I think, $37 to $45 million sale of that property. When Dorothy Dix was first established, there was a stipulation that any future sale of that property, the proceeds would go to funding mental health care. So the state honored that commitment and donated several $1 million to different groups across the state to provide the care. Cape Fear Valley saw the need here with our community and with children and adolescents, and we put in an application for that funding to help build this unit. And that's where it came from. That's why we proudly call it the Dorothea Dix Care Unit for adolescents. We received $4 million from the state to build this unit. And to me, it's not a penny wasted. It's money very well spent. And we're just real excited to have it. The opening date, we're real excited, is early February. We're now at the point of picking out finishings and getting furniture ordered and soap dispensers and all the little things that I'm not an interior designer, but I've learned a lot about it in the last couple months. It's just a great feeling to walk through those halls right now and know that here in just a matter of time, people will be able to get the care that they need here in Fayetteville and Cumberland County without having to go, like Dr. Fleishman said, anywhere from 1 to 3 hours away. And the parents will be able to have their children's needs met. You know, the story that I tell a lot is if you are next door to Fort Bragg, the largest Army installation in the world, and you are a soldier who is deployed over into the Middle East or somewhere, and your spouse is at home struggling to care for an adolescent that has psychiatric needs, and then they've got another child that's at home, and then when you hospitalize that child 3 hours away, how do you get child care? How do you get to go do the family sessions? How do you get those things met to where you can meet all of your family's needs? So if you can just simply drive around the corner and come to Cape Fear and have your child here, you can meet those needs all at one time. And we're excited to be able to help the community in that fashion.
That's exciting, John. You know, we have heard for many, many years that people care about what's going on with the behavioral health services that we have for our adolescents. How can the community be a part of the project for the Dix unit?
The community has been outstanding already. Just talking to people when we walk through town, and I proudly wear my badge, people see that I'm with behavioral health, and they talk about the unit. They talk about Cape Fear. They're excited about the whole residency program. But it's also exciting to know that we've got, and Dr. Fleishman was citing the shortage earlier of child psychiatrists. We've probably got more child psychiatrists on staff here than any other place that I know of. And the community just supports what we can do to help them. I will tell you that we've already received $40,000 or more as just simple donations to help buy. You know, the construction is one thing, and that's a big construction project, and that's huge. And that's so appreciated by us that the state, DHHS, will provide that funding for us. But even more than that is when we get down to the nuts and bolts of providing the appropriate kind of furniture, the clinical equipment, all those things, that's being supported by our community. They're giving us this money to say, hey, go help those kids. And we're excited about that, and we're so appreciative of the community. We are still taking donations, and anybody I'm sure can contact you, Sabrina, and gladly will talk to anybody that would like to know what those funds are being used for. But the best thing is that we turn every penny around and turn it back into the unit for clinical equipment, therapeutic services. We're hoping to be able to establish a fund for people that if they need transportation to their appointments and stuff like that, we might be able to dip into this fund to be able to do that. We don't want to have any barriers to people being able to get the services that they need. And the community has just been so helpful for that.
I just want to say that $4 million doesn't go as far as you would think it would. Being a part of this development, the cost for putting and building a psychiatric bed is over $440 a square foot. And for anybody that knows about building homes, it's just such a high cost in that when you hear $4 million, you say, oh, wonderful, we're going to be able to do so much. And it's really been just creative how, you know, we've been able to build this for that amount of money, because it just doesn't go very far when it comes to building the appropriate facilities for treating anyone in behavioral health care. There are strict guidelines on what's allowed and what isn't allowed. And that's, you know, one of the reasons that it's just so important that we do get community support to help us do some of the extras, because we want to make sure that our teenagers, our adolescents really get what they need. And we're going to make sure that it's there, but we want to help them along in other ways, like Mr. Bigger was just commenting to us.
Very good. Thank you. So we know we've got this great facility on board. We've got great leadership. Let's talk about our residents and those up and coming young doctors who are going to really help with this program and move it forward into the future. So as I noted earlier, we have 2 of our psychiatry residents with us. So I'm going to open it up just to let them hop in. But a couple of things that we'd like you to share, Dr. Teague and Dr. Vaught, is why did you choose this program? What brought you to Fayetteville? Why did you want to come be a part of this program? And tell us a little bit about what your experience has been like here at Cape Fear Valley. So I'll let you all just jump in as you will.
Okay, I can go first. I kind of ended up here by accident. My husband was working here. That's how a lot of people end up here. Someone's working at Fort Bragg, but also I felt after speaking with Dr. Klenzak that it was going to be a good quality program that really valued resident wellness, and also that was really focused on resident learning, academic opportunities. I got, a really good feeling about the program. So I definitely took a chance on coming to a new program, but it was, after 4 years being here, I've made really wonderful relationships. I think we've created a really good culture within the residency program, and everyone, faculty and residents have participated in creating that. And so that made my decision to stay here very easy. I like who I work with. I like coming to work every day. I feel very invested in the program. I think coming on early, in the early stages and seeing how it's grown, it's hard not to get that sort of entrepreneurial mentality where you see all the other things, all the possibilities where it might go, ways to improve or build upon what we already have here. And it seems like there's a lot of exciting opportunities for a young psychiatrist here. So yeah, it's turned out to be a really positive experience. And I've also really feel like I've been embraced by the community. I love my neighbors. My kids are settled and happy here. So it's, it was easy to choose to stay. Thank you.
That's great. Thank you. Dr. Vaught, can you tell us a little bit about your experience?
Yeah, sure. Ironically, I'm kind of like Dr. Teague in this nature. It was kind of an accident, but it was probably one of the best accidents to ever happen to me. So I came in as a transitional year, and about a quarter of the way in, I was lucky enough to have a rotation through psychiatry, fell in love with the program, got in touch with Dr. Klenzak, and they had an open spot, so I jumped on it, and it's been phenomenal ever since. I feel like the program itself really I enjoyed it because I actually like the smaller program kind of style. I have more interaction with my attendings. I get to really learn a lot kind of one-on-one, which is good for me. We see a very, very large amount of patients, and I think compared to larger programs, we probably see on a day-to-day basis more than they do, which is great because I feel like even as a second-year resident, I've really learned a lot. I've really got a lot of good experience. The pathology and the type of psychiatric disease states we see is just it's enormous, to say the least, and it gives me a lot of experience, a lot of learning. I think one of the things with my experience here is when I came in, there was rumors that there was going to be a child and adolescent unit, and lo and behold, those rumors have come through fruition, and here we are. So that's really exciting to me because that's somewhere I wanted to go with my training and something I want to do with my future is child and adolescent psychiatry. Like Dr. Klenzak and everyone else had said, is that we've got kids that hang out down there in the ED forever that I go see, and it's really nice to have that follow-up, be able to see these children and kind of do the therapy and be able to be part of their care transition. I think another thing about this program I love is I love everyone I work with. I enjoy working with my attendings. I have great relationships. They're very supportive of me as both a professional and a person. My baby was born in May, and pretty much every day I walk around, oh, hey, how's the baby? How are things going? So I feel like they treat me very much like a human being as well as a doctor, and it's very nice to have that kind of camaraderie. Same with my residents, they're not just people I work with, they're my friends. I've really had good relationships built here. It's really been very great for me personally. So yeah.
That's wonderful. Well, we are fortunate to have both of you on staff and part of this program. Let's talk a little bit about the Center for Medical Education, and I'm going to just open this up to either the faculty members or to our residents. What is that facility going to mean to our residency program in general?
Well, for me, if I can jump in, I think that having a large facility to bring in speakers where all the residents can attend is probably essential for moving forward as an academic hospital. It's really an important part of kind of that academic medicine experience. So I'm really personally excited about that being available.
Now, I believe it's going to bring Cape Fear up to another level. Not only will it allow us to bring speakers in for grand rounds and other types of medical meetings, it's going to provide the facilities that our residents and even students can begin to learn at. It also provides the necessary kind of private space for residents to be able to study or just take some downtime. We all hear a lot about resilience and burnout. And we all know that in the past 2 years, the pandemic has done a tremendous amount, I'll say, damage to the medical community. Many people who are physicians or nurses or other medical providers have left treating patients because of what happened in the pandemic. And I think having this center is going to make a difference. It's going to be a place where residents can go, students can go, attendings can go, just to get away from being in clinical care a little bit and work towards their resilience and some wellness. So it's going to be tremendous in many different ways. And it's going to be a real beacon for the community. Fayetteville is still growing, and this is going to help us grow even more.
That's very exciting. And of course, that facility, all of our residency programs will have the opportunity to be together there. So I would think that that's going to give some opportunities for collaboration amongst the other residence programs. Dr. Teague, Dr. Vaught, can you speak to your interactions with perhaps some of our other programs in the overall residencies?
Yeah, I can probably drop on this one. Coming in as a transitional, I got to meet a lot of other kind of specialties, and from that, I formed a lot of really good relationships from our consult service, kind of being able to talk with other residents. It's pretty rewarding, honestly, because you get to see that communication across multiple specialties kind of happen, and it's definitely, I think, just going back to the GME building, to be honest, it's really going to improve that communication. So for me, working with all these other residents, it's a very unique experience because we have relatively few residents compared to the overall.
Right.
But yeah.
I'll jump in there too. So it's really been a difficult, year and a half, 2 years with COVID, and it's caused a lot of isolation. And for a while, we were doing virtual didactics. We weren't really meeting in person. It was really kind of feeling disconnected, and the stress of the worries about COVID and the stress on the medical system. So I think the hub, the building, is going to be really pivotal going forward in terms of fighting against that isolation and burnout and fostering relationships, and having a space that's your own is critical. And like Dr. Teague mentioned, it's going to be an academic space, it's going to be a supportive space, it's going to be a resident space. It's going to be great, and we're so excited about it. It's going to help with recruiting other residents, and recruiting stronger residents, and recruiting doctors. It just is going to build on it, and so I think we can't stress how important it is for the overall feel of the hospital, the medical staff, the residents, the GME efforts. So yeah, we're just thrilled with it.
Yeah, I think it fits the description of the retreat areas for both faculty, med students, residents to work together, to talk, meet each other every day, because we work every year to make sure we have these retreats going on for residents and faculty. But this building will be the icon for that to happen. So we are really excited about it.
That's great. We are as well, and I hope that it will be opening this coming June, or I should say summer of 2022. Another important piece of our behavioral health services and our psychiatric residency program is our outpatient clinic. The foundation was fortunate to have secured $1 million grant from the Duke Endowment earlier a few years ago to help with that outpatient clinic. So John, I'm going to ask you to talk a little bit about that particular clinic and how that works with the other care that we provide the community.
Thank you. And I'm glad you brought that up. That is our diamond in the rough. The residency clinic is such a unique opportunity for both the residents as well as the clients that we serve. It's not everywhere you can go. We're here about 1.5 miles away from the hospital, and we occupy 3 floors of this building. The 3rd floor is our psychotherapy department. The 4th floor are our medication management providers and our mid-levels. And the 5th floor is the residency clinic. The coolest thing about that is that the residents get to see their patients both for medication management and psychotherapy. Most places that you go for mental health care on an outpatient basis, you will see a psychotherapist for an hour, and then the following week, you may see them for 15 minutes to get your medication checked. Here, it's one-stop shopping, so to speak. The patients can come in, they'll see their psychiatrist resident for their med management, and then they'll put down their prescription pad and they'll say, so what else is going on with you? And then they'll start doing the psychotherapy. The cool thing about the psychotherapy component is that they're getting training from our psychotherapists too. Our psychiatrist attendings are fantastic and do great training, but we've got experts in cognitive behavioral therapy, dialectical behavior therapy, motivational interviewing, all those things that a good, well-rounded psychiatrist needs to have in their toolbox to be able to meet the needs. I will also tell you that in an ironic sort of way, they've got the best floor in the building because it was newly renovated thanks to the foundation's grant. And it's just a real nice, comfortable place for people to come and get the care they need on an outpatient basis.
That's wonderful. Thank you for sharing that. We are getting to our last few minutes of our time together. I want to encourage listeners, if you have any questions, to put those in the chat feature so we can address those before we leave. But I want to open it up to the group and let you all share anything that maybe I haven't asked or that you want the community to know about this program.
I just have a few more words before we end. I know with the fellowship and the residents, child and adolescent and general residency, it's not just about working at Cape Fear Hospital or Dorothea Dix or behavioral health care, but our residents and fellows will be giving their services into the community. We'll be working with Fort Bragg. We'll be working with the Cape Fear Pediatric Clinic. We'll be working with community care. We'll be working with a lot of this.
You
I'll
kind
jump
of
in.
Sorry, I got disconnected.
Yeah, go ahead.
Yeah.
You're back.
So just wanted to say that this will be a huge step for having the residents and fellows to be able to provide these services for the whole Cumberland County and Bladen, Hoke, and Harnett counties. Thank you.
And I'd like to jump in real quick if I could too. One of the slides that Mr. Nagowski showed was about the Carolina Institute for Clinical Research. I think the GME building is going to be a great source for research. And that's something that is key to any academic school, academic medical setting, is the research that can be provided. So I think there's going to be lots of opportunities for that to occur through the new building as well. And I'm excited about those opportunities as well.
Thank you.
And not to take away from, we're very excited about the Child and Adolescent Residency or Fellowship opening up, but I do want to say we're extremely proud of the residents that go on and do a general psychiatry residency for treatment of adults. Dr. Teague is one of those, and we're really pleased that she's decided to stay with us next year. It's going to make a big difference. And just, even though we're going to produce child and adolescent psychiatrists, hopefully in the future, we're going to produce between 4 and 8 general psychiatrists every single year. And that's going to be a tremendous help to this entire area. And so I didn't want to sell them short, because our general psychiatrists are the backbone of, all the work that gets done. So We're excited because we're going to have the adolescent unit, but we still treat adults in our adult behavioral unit or BHC, and appreciate all the work that all of our residents do, and especially the GME office and Dr. Maharty for what they've done to make it all possible. Thank you.
Thank you. Well, I want to thank our panelists for all that you have contributed to the conversation today. I want to thank the listeners for you taking your time to learn more about the Psychiatry Residency Program and our behavioral health services in this community. If you know somebody who might want to hear this information, a recording of this discussion will be available on our Facebook page, and certainly the foundation staff can provide this information to you as well. We appreciate everyone who has offered support in a variety of ways to make the residency program and our behavioral health services the best that they can be for our community. Our community deserves the care that we are now able to provide, and we're just so excited and grateful that so many people are a part of what we do to take care of this community. I want to wish you all a very happy rest of your day. Enjoy the sunshine. I think there's a little bit out there, but I think we're going to get some rain tomorrow. So enjoy it while you can, and thank you again for everyone's time. Have a good evening.
Thank you.
Bye. Thanks.